But it's true, when you're looking at getting a realistic expectation of your body, we have to look at it through the lens of the OG.
Behind the mask, the more you know, the better you look. Behind the mask,
I don't like it when I take them off because I start to...
the better you look. Behind the mask.
Hi, it's Dr. William. Welcome to another episode of Behind the Mask, Season 2, Episode 14. It's really gone quickly this year, and I thank you very much for joining me. Tonight, we're going to talk about how to get a realistic expectation before you have your BBL. So a lot of times, patients come in and we sit down and we have a consultation, and patients want to know how they're going to look after they have a BBL. And so I understand this clearly. This is a really important part of the consultation for us to really arrive at some type of realistic expectations for how patients are going to look. You know, patients want to show me wish pictures, or patients will show me photos of my own work, patients that I've operated on, or other times patients will show me their own photos, but they've edited them with Photoshop. And the problem with all of these types of things, whether they're wish pics, my work, your own photos that are edited, none of these things take into consideration all of the components that make us individuals. And this is why these ways to get an expectation don't really work. There's so many different things that are different about us. We have different heights. We have different shapes to our skeletons. We have smaller waist, larger waist. Sometimes patients have more fat in their hip area. Sometimes patients have low soil, high soil, medium soil. Our gluteus muscles all attach in different locations to the pelvis in about the same area, but they're slightly different that it can produce a really different shape to the butt. Not even mentioning the shapes of the pelvis, the height of the pelvis, the skeleton. All these things are make for a vast difference between all of us and make forming your expectation based on a wish picture just not a good way to form an expectation. What is the solution? Well, the solution is the OG. And I know you maybe think that my solution for everything is the OG, but it's true. When you're looking at getting a realistic expectation of your body, we have to look at it through the lens of the OG. And what do I mean by that? I mean by I start by looking at you up high in the back where I begin the OG lipo to see where your true OG line is, where your true waist is. Then I talk to you about, what can we do with your hips? What's your soil like? Do you have hips already? What's the height of your hips? Where do I think that point of maximal projection is going to be? And so that's your best way to figure out how you are going to look after having a BBL. And it's just with you and I discussing things, and I'm physically pointing out things on your body. And so when we go through these things in sequence, we can really get a better idea of how you're going to look. And if we kind of break these down into the individual components and we look at your back, we can find out, how much fat you have in the back, what is skin, what is fat, how is that going to look? Look at your true waist. You can see your actual true waist. Where is this going to be when the liposuction removes this fat? So for example, you can see where your true waist is. Here's where your waist is before surgery, but after removing the fat, here now you can see where the true waist is. Look at a hip here preoperatively. Here she's kind of flat, but now after adding the fat to the hips, you're going to be able to see a much better shape. This is a realistic view of what the hip will look like afterwards. You can see here when the hip dips are filled in. You can see here where hips are built. You can see here where we've added volume. All of these components together, all of these, following all of the principles of the OG, when we're getting a small waist, building out the hip, filling in the hip dips, adding volume, are going to change the shape. So if you start to look at your body in this regard and start looking at what your expectation will be through the lens of the OG, now you're going to really get a better idea of how you're going to look after having a BBL. Sometimes when I've seen a wish picture, actually in my head, I will think to myself, wow, they're actually going to look better than the wish picture. Now, that's not because we're doing a better job. That's because they have a totally different body and they have a better body. And so when you reveal it with the OG, they're actually going to look better than the wish picture. Same thing with Photoshop photos. I can't tell you the number of times that I've had patients come in and have their own photos that they Photoshopped, and then when the end result is said and done, they actually look better. Here's an example of somebody who brought in a Photoshop photo of themselves. Here's her preoperative photo. Here is her photo with the Photoshop editor. And here is her true, real result after having OG lipo and a BBL. So you can see her body looks better after having a BBL than it did with her own photos edited on Photoshop. It's because patients are not plastic surgeons. They don't know the power of liposuction and they can't recreate that with Photoshop. So even an edited photo of your own body doesn't necessarily look exactly like you're going to look after having a BBL. And so the important thing really to understand is don't rely on these other forms of expectations. Look at your body, think about what it would be like with the OG, and then when we sit down and have a consultation, I can show you in person the changes that we can expect with a BBL. So let's talk about BMI just for a moment. BMI is kind of a poor guide in my opinion. I know that I use it and we kind of have to use it to have some general guidelines. You can have a patient who has a BMI of 27 and they have to lose weight in order to get rid of their internal fat so they'll have a much better result. You can have somebody with a BMI of 31 who I don't ask to lose any weight because their weight is fine because they have a larger build and so they naturally have a larger BMI. All athletes tend to have a larger BMI because they have a denser and greater amount of muscle mass, and muscle weighs a lot more than fat. So BMI is just a guide. Please don't lean on it super heavily. It's just a guide to kind of help us a little bit, provides a cutoff for limiting patients who are just not good candidates, but it's not the be-all and the end-all. So for example, if you look at a picture of my patient, but a different person, you know, you may look better than that patient. You'll have the same style. All my patients have the same style. I could pick out like a mugshot book, who's my patient and who's someone else's patient, because that's my style, that's what I like to do, that's the OG look, that's what I think looks the best for patients. But you could look at a photo of my patient with my style and you may end up looking better. It doesn't always mean that if you're showing me a picture that means you're going to look worse. You may look better because you might have tissue that's softer that I can put more fat in. You may end up with a larger butt. You may end up with a more voluptuous hip because your hip has more fat to begin with, or because your tissue there is really soft and will distend. You may naturally just have a more exaggerated hip and a smaller waist, so your OG line will be tweaked. We're always going to get the OG line, but remember, that OG line will shift along its axis. Some people will have smaller waists, some people will have larger hips. All of that is very variable. So if you're going to show me a photo of a patient of mine with the OG, then you're going to get that look. Not exactly the same, you won't look like that picture, but you're going to look like that picture with your own body. And that may mean smaller waist, larger hip, more fat in the legs, all the different things that your tissue will allow me to do. So I guess my whole point with all of this, talking about these expectations, are don't rely on someone else's photo. Don't rely on a photo of my patient. Don't use Photoshop to edit your own photos, but look at the shape of the OG line and then sit down with me and we'll look at you and we'll look at all of these different areas and we will see, you know, what is the very best that we can do. Don't forget, I want the very best. I want the smallest waist. I want to have a nice full round hip that's blended into the leg. I want nice volume. These are all the things that I want. I want the exact same thing, and I have the same expectation. The only things that we're limited what we can do with tissue. That's not always a bad thing, because sometimes patients' tissue can really exceed what our expectations are. But our expectations have to be realistic, and I think the best way to do that is to sit down, have a discussion, examine your body, and come out with a really true, realistic expectation for your body. Thank you so much for watching. I always appreciate it. And I look forward to seeing you on the next episode of Behind the Mask. Thank you so much for watching this video. If you like it, then please subscribe to my channel and turn on the little bell so you get notified of upcoming videos. That's my mission, that's my job, is to educate you so you're more informed about a plastic surgery and about plastic surgery procedures that you may be interested in. Thank you so much for watching. See you next time.